歡迎大家嚟到今日嘅簡報。
Welcome to the press briefing. With us today, Dr. Chang Shuk-Kwan, Head of Communicable Disease Branch Center for Health Protection, and Dr. Larry Lee, Chief Manager from the Hospital Authority. Dr. Chang will first brief us on the cases. Good afternoon. Last night, there were 446 positive cases through RAT and 301 through the RAT tests, and the total number of cases was 747. Since the fifth wave started, there were a total of 1.185 million positive cases, including 742,603 positive PCR tests, as well as 442,591 RAT positive cases. Of the 446 positive PCR tests, 63 were found through the Hospital Authority. Our labs uncovered 127 cases, as well as 256 cases detected by private laboratories. Of the 203 cases, we conducted genome sequencing. We did not find any cases that tested positive to the L452R strain. All 198 cases were positive to L452R, and there were 5 pending cases. Of the cases today, 11 were imported, of which 10 tested positive through PCR and 1 through RAT. 5 of the cases arrived in Hong Kong on the 16th via 5 different flights, including 3A316, 1 case arriving via OZ745, and 1 via 5J272. 2 cases arrived on the 15th via CX724. 4 of the cases arrived in Hong Kong earlier. We did not have new outbreaks at residential care homes of the homes that have seen outbreaks before. 13 residents and 1 staff member were from 7 RCHDs and 3 RCHDs, and there were new cases reported. Of the fatalities, the HA reported an additional 29 fatalities, bringing the total to 8,867. These were cases reported by the HA. Together with the 559 other cases, since the fifth wave started, the number of fatalities stand at 8,926. These includes 3,680 females and 5,246 males. The age distribution and median are similar as before, so I won't go into the details. That's all for my report today. Dr. Lee will now brief us on the situation at the HA. Currently, 8,247 patients are staying in various public hospitals: the North Lantau Hospital, Hong Kong Infection Control Center, HA Infectious Disease Center, and the Asia World Expo Community Treatment Facility. Last night, 3 patients were in critical condition. 1 of them did not have any vaccination records. 2 received 1 shot. 8 were in serious condition. 51 patients in critical condition were staying in ICUs. As of midnight, over the past 24 hours, 24 patients who tested positive passed away, including 11 males and 13 females, aged 55 to 105 years old. Of the 24 patients who passed away yesterday, 11 were from residential care homes, 9 had no vaccination records, 2 received 1 shot, and 22 were elderly people aged 65 or above. 2 were younger than 65. And I'd like to brief you on the case details. A 55-year-old female had chronic illnesses. She received 2 shots of Sinovac. She had inflammation in her kidney, and she suffered from systemic lupus erythematosus, or SLE. A tumor was detected, and on the 22nd of March, she was admitted to Tuen Mun Hospital due to her clinical conditions. She had high calcium content in her blood. After she was admitted, her RAT result was positive. Her CT value was about 20. She was transferred to an isolation ward, and she received IV fluid, and she was prescribed with the Paxlovid antiviral. After she was admitted to hospital, she exhibited multiple symptoms. She had anemia, and she received transfusion, and she experienced pneumonia, and she was prescribed with an antibiotic, and her blood oxygen level fluctuated, and she was given oxygen. Her conditions continued to deteriorate, and she passed away in the afternoon on April the 16th. The second patient was a 64-year-old female with chronic illnesses, and she had no vaccination records. She suffered from a stroke, and she had renal conditions that required dialysis. And on the 20th of March, she was admitted to Huanghua Hospital. She had a poor appetite, and she was fatigued, and her renal conditions deteriorated. After she was admitted to hospital, she took multiple PCR tests, and between the 22nd of March to the 2nd of April, she received 3 tests. There were 3 negative results and 1 positive result. CT value was more than 30. While in hospital, she received treatment for renal failure, and she had a very high creatinine index at above 1,000. She received blood dialysis, and on April the 4th, her heart once stopped beating, and she was intubated and received resuscitation. Her conditions continued to deteriorate and continued to suffer from pneumonia, and she passed away on April the 16th at about 7 p.m. And due to a backlog of data, between the 5th of March to 15th of April, 3 more patients passed away, and 647 were discharged. 1 patient was classified as a close contact. In terms of staff members, 21,826 staff members tested positive. 20,820 have recovered and returned to their posts. The floor is now open for questions. Please identify your media organization before you speak.
We will start with the lady in the middle. I'm from cable TV. Now, we are towards the end of the outbreak, and recovered patients have experienced long COVID and multi-system inflammatory syndromes. For the authorities, do you have any tally or data and any analysis concerning these situations? Will you make reference to the advice from Dr. Ivan Hong regarding allocating resources to support services, that is, interdepartmental treatment options and stepping up outpatient services in addition to Chinese medicine treatment possibilities? For recovered patients, the hospital authority attaches importance to treatment for patients. We have many seniors who came down with COVID. On 3 fronts, we provide specialist outpatient clinic services. There are different outpatient specialist services available depending on where you live. And we also have specialist treatment like physiotherapy or occupational therapists. Such follow-up options are available. For persistent symptoms or patients with irregular blood conditions, these patients will be referred to the specialist department for follow-up options. For patients in care facilities, we arrange outreach teams in suitable cases. We also mention these Chinese medicine consultation services. For patients within 6 months after recovery, they are entitled to up to 10 free consultations. Now, for multi-system inflammatory syndromes, we received 15 such reports regarding this condition. It could be that the viral infection triggered such a problem in the immune system. And this condition happens within a few weeks or months after the recovery. Some children experience very serious condition and require intensive care. So parents should pay attention to the recovery of their children. If their children feel unwell, take your children to a doctor. The best way to prevent infection is vaccination, so take your children to a vaccination center as soon as possible. Next question. The journalist at the left. I'm from Phoenix TV. 3 Omicron-specific vaccines have been cleared for clinical study in Hong Kong. That happened yesterday. But does it involve mixing and matching different vaccines? What kind of assistance will the SAR government provide? The government mentioned that after the outbreak eases off, there will be a serious study into how the tallies are analyzed, and especially involving the death rate. For clinical trials, it depends on the kind of permit or license for the clinical trial. For details, you will have to refer to the body applying to do the clinical trial. As for the way the fatality rate is calculated, we have been analyzing this rate, and we rely on expert advice. As our chief executive, that is the chief executive of the hospital authority, he also mentioned some preliminary details. But we're still conducting the study, and the details will be announced when available. Next question. I'm from Now TV. Yesterday, Professor Sophia Chen said that the Hospital Authority, the Center for Health Protection, and the Education Bureau will have some drills regarding possible outbreaks after class resumption. What's the drill like? What kind of drill has been run? What's the risk for rebound concerning class resumption? We also expect the social distancing rules to be relaxed soon. Will the compulsory testing notices start covering restaurants and other catering premises? Will the Leave Home Safe app also start sending exposure notifications for these catering premises? Will there be analysis done concerning places where infected persons have visited? The drills. The HA can tell us more in a moment. But for us, we have conducted some scenario-based drills with the Education Bureau to step up communication between different parties, and we also have a discussion over how to intervene in a timely manner when something comes up. As for the possible rebound, after the social distancing rules are relaxed, there may be some rebound. As the people flow increases in a city, a rebound may be possible. As people go out or engage in more social activities, they should maintain good personal hygiene and put on a snugly fit mask. As for compulsory testing arrangements, the arrangement is still based on residential units. With class resumption coming up, we are getting prepared. For the hospital authority, there are different stakeholders. We involve them in the drill. And for the hospital authority itself, we have the central committee that have engaged stakeholders in meetings. Hopefully, the hospitals are prepared for a surge in child COVID patients. As for the community treatment facilities in the North Lantau Hospital, we're also contemplating ways to support different families in terms of hospitalization needs. We'll take an English question.
Good afternoon from SCMP News. May I ask, has the BA5 Omicron patient in Regala Sky City been discharged yet? And has there been other BA4 or BA5 cases found on arrival through imported cases? Thank you.
There have been no other reports of BA5 or BA4 cases so far from our laboratory.
下一題，各位女士。
We'll take the next question. I'm from TVB. We have the long holidays in the outlying islands and in the countryside and even in the city center. Many people are out and about. As the CHP just said, you're worried about a rebound in infections. And when that happens, what kind of preparations have you made? Other journalists have mentioned the contact tracing. Now, since the infection numbers are dropping, we're towards the end of an outbreak. At which point, in terms of infection numbers, will you resume contact tracing efforts? With more people out and about, we expect some mild rebound. But we have to refer to a range of indicators, such as those who test positive during testing exercises, the infection numbers, the situation with the sewage surveillance project, and the HKU study regarding the reproduction rate. These things have to be taken into account. We haven't resumed contact tracing for individual cases, but for target groups such as care home for the elderly, we do have the relevant efforts going on, and also for the care homes for the disabled. When cases are reported, we handle them quickly. Next question. The journalist at the back. I'm from Mingpao. You said that you're expecting possible outbreak after the holidays. For the Center for Health Protection, what's the risk of a rebound? What's the extent of rebound that you're expecting, and what's the contingency plan? A question about the designated clinics. There's been a drop in demand for the designated clinics. What's the usage and appointment situation with the clinics? When will you be adjusting the services at the designated clinics? Another question about the antiviral drugs. You said there will be a list of private doctors showing which practitioners have the drugs. How many private doctors have obtained the antivirals? A question for the hospital authority. Can you tell us about the usage of the antivirals? We don't have a hard and fast indicator in terms of what counts as a rebound, but we keep an eye on the overall trend and the various indicators. The government has relevant contingency plans in case a rebound happens, and the government is prepared. The hospital authority has also made preparations. For private doctors who have obtained the antivirals, the Food and Health Bureau has issued data. There are roughly 150 private doctors who obtained the oral drugs.
口服藥嗰度我都想講翻就。
In terms of antivirals, as of April the 16th, public hospitals have prescribed COVID antivirals to more than 26.9 thousand patients. For designated clinics, 23 designated clinics have commenced operation, and we would prescribe oral antivirals based on clinical guidelines. These clinics can provide as much as 4,000 consultation lots per day. As of April the 15th, 5 p.m., we have provided consultation services to more than 11.7 thousand patients. We do have consultation places remaining, and we will continue to monitor the pandemic and service needs. As social distancing measures are relaxed and classes resume, we would reserve sufficient places to meet the service demand, and we will adjust our services as needed. Next question, please. This is from News. We have seen more cases of multi-inflammatory syndrome among children. Many people or parents do not know too much about this syndrome. Are you going to step up your publicity efforts in order to promote understanding among parents and for them to encourage their children to get vaccinated? For the multi-inflammatory syndrome, some children who contracted COVID would have a response triggered, and they were admitted to ICUs. We would take in the views of different experts and we will see what we can do in terms of follow-up services or data collection going forward. Any other questions? The speaker is not coming through the microphone.
Follow-up from this patient. And he has become asymptomatic when we last interviewed him. So I believe he has been discharged from the Gala.
咁記者會到呢度結束啦，多謝。
This is the end of the press conference. Thank you.